Okay, everyone, we're going to go ahead and get started so we can use all of our time. For those of you who don't recognize my voice, this is Michaela Ferrari. I'm the coordinator for the LA County Perinatal and Early Childhood Home Visitation Consortium. We're really excited to be working with the Children's Partnership and the UCLA School of Dentistry in order to bring this training to you. A few housekeeping items before we get started. Just so you know, all of you are on mute. The only folks that are unmuted are the presenters, and that's just to cut back on unnecessary background noise and echo. You can use the chat box in your control panel to ask questions. So if you look at the control panel on the right-hand side of your screen, there's a little chat box that's sort of a drop-down menu. So you can type questions in there. You can do it throughout the training, or at the end we'll also have a Q&A portion, so you can do it. You can save your questions for the end if you want. We are recording this webinar, so the link to the recording will be sent out to all of the registered attendees next week. Along with that, we'll also be sending the PowerPoint and FAQ based on the questions we get during the training, and then potentially some other resource materials. We will also be sending a post-training survey. We would highly encourage you to complete the post-training survey. It'll be very brief, but we encourage you to complete that as the information will be used to create future oral health trainings. So feel free to ask any questions during the training or save them for the end. And again, just a reminder that everyone is muted, so questions need to be typed into the chat box. So as many of you know, good oral health is critical to the health and well-being of both children and pregnant women and other members of the family. And all of you, as either home visitors or other service providers who work with pregnant women and families with young children, can play an important role in helping them understand the importance of good oral health and also help engage them in positive oral health behaviors and access dental care. So today we're going to hear from 3 different speakers. Kaitlyn Crowley is a Senior Policy Associate at the Children's Partnership. Jenny Catlove is a consultant for the UCLA School of Dentistry. And Lisa Nguyen is a pediatric dentist and trainer at UCLA. So during this webinar, you'll learn about the prevalence of oral disease, especially among young children and pregnant women, and its consequences. The barriers and solutions to achieving optimal oral health, including how to get dental care through Medi-Cal, and strategies for how home visitors can address oral health issues with the families they work with. The presenters will leave you with plenty of resources to learn more as well. So before we get started on the content, we wanted to just do a quick poll and see where all of you work. So unfortunately, we have to break up this question into 2 different polls because there are so many service planning areas in LA County. So the first poll will cover service planning areas 1 through 5. So we'll do that now. So if you could just go ahead and answer according to which service planning area you live in. And we will also be asking about 6, 7, and 8, and all of LA County, as well as SPAs 9 and 10 in our second poll. Okay, looks like we're leveling out on this first half. About 27% are from SPA 1, 32% are from SPA 2, oops, changing, 35% from SPA 3, 9% from SPA 4, and 4% from SPA 5. I'll go ahead and launch the second poll. Okay, a lot of folks from SPA 8 in this one. We also have 21% from SPA 6, 14% from SPA 7, and about 10% from countywide or other. I had a couple questions about what SPA 9 and SPA 10 are. One SPA 9 is for Native American Indian populations, and SPA 10 is for Asian American populations. Okay, with that, I'm going to go ahead and close this poll and pass this off to our next presenter, Dr. Lisa Nguyen.
Hi, everybody. Thank you for being here today. So I am currently in SPA 5 right now, and I work in SPA 2, and I live in SPA 4, so kind of try to make my rounds in Los Angeles County. So just to build upon what was already said, we do like an interactive process. So, please feel free to ask your questions in the chat on the side there, and please let us know what you might be more interested in the future with that post-webinar survey. So I did want to take a few minutes to talk about oral health disease. Although I am a pediatric dentist, I truly care about the oral health of everyone because all the little patients end up growing up into adult patients, although maybe even in my heart, we all stay forever. Unfortunately, though, oral health is not really considered, I guess, a sexy topic of conversation. But I hope by the end of this, we can all understand a little bit more of its importance in oral health and the roles we could play to help families be healthier. So, with that said, I wanted to show you guys this slide here. Dental caries used to be thought as simply just a hole in your tooth, which is a cavity. We now hope that people come to understand that dental caries is more like a tug of war between risk factors such as bad bacteria and frequent sugars, and protective factors such as saliva and fluoride. If those risk factors win this tug of war, the consequence ends up being a hole in your tooth or, like we discussed before, a cavity. So as you can see here, the cavity can start as something small. And if the risk factors continue to win, eventually that hole can become bigger where we can experience pain, possible infection, and even loss of a tooth. So another important issue of oral health is known as periodontal disease. There are two facets, gingivitis and periodontitis. There's a little sketch of what gingivitis looks like. I would have used a real picture, but I wasn't sure if you guys were all close to eating lunch or perhaps eating lunch now. But so gingivitis is basically an early stage of periodontal disease where gums can become red, swollen, and maybe even bleed when we're brushing it usually due to long-standing presence of harmful bacteria. Periodontitis is a more severe stage of the periodontal disease where bacteria causes loss of structures that support the teeth, also known as bone loss, which might be a more common phrase. I usually like to say that if we think of our teeth like trees with roots in the ground, periodontitis would be more like removing the surrounding dirt that keeps the roots in the tree stable. So without the surrounding dirt, the tree could easily tip over when we are chewing something. So unfortunately, dental caries and periodontal diseases are quite prevalent in our family here in California. Well, everywhere, but especially here in California and Los Angeles. So with the prevalence of oral disease among pregnant women here, 65% of pregnant women had no dental visit during their pregnancy. Over half reported a dental problem before they got pregnant. And we have found that the primary reason why pregnant women didn't see the dentist was because they actually didn't know it was important. So there was a lack of perceived need, among many other reasons. But it is safe to see the dentist during any part of the pregnancy, and we do recommend routine and preventive care. always. So unfortunately, being pregnant can put you at higher risk for oral diseases. So changes in your hormones could lead to periodontal diseases or worsening of existing perio conditions. So that will again be red, swollen, or bleeding gums. Unfortunately, pain, difficulty eating and drinking. With morning sickness and nausea, the acidity of that could cause teeth erosion, increased dental tooth rate as well. Changes in our diet, which sometimes, we eat more crackers, more juice, things to make us feel a little bit better, or to quench our hunger. It also increases the caries rate. And then the more frequent snacking can also increase our caries rate as well. So studies have shown that periodontitis during pregnancy could be associated with these factors here, including gestational diabetes, preeclampsia, preterm birth, low birth weight, and even transmission that caries causing bacteria to our children. So that would lead me into talking about our kids. Here again in California, over half of our kids have tooth decay by the time that they're in kindergarten. And sadly, over 70% of our kids have caries by the time they're in the 3rd grade. So dental caries is the #1 common chronic infectious childhood disease in the U.S. It is 5 times more common than asthma. And I think ones forget or do not know that children actually keep their baby teeth until they're around 10 to 12 years of age. I even have 16-year-olds with baby teeth still. And if tooth decay is left untreated in these baby teeth, it could lead to pain, of course, their inability to eat properly and to grow. It can affect the way they talk their speech. And if they are having pain, it could be difficult for them to learn and concentrate. Of course, it doesn't look good. And it can damage developing permanent teeth as well if there are infections there. There are infections to throat, eyes, and brain. There could be missed days of school and parents missing days of work as well. Unfortunately, once it gets to a certain stage, there could also be very high cost of care as well. So here in California, California children miss almost 900,000 days of school per year due to dental problems. This costs schools $29 million, resulting in a reduction in average attendance rates. Children who reported having recent tooth pain were a lot less likely to do well in school, and they actually showed to have a lower grade point average. So prevention is super important, is key. There are a lot of simple facts that we could, little tidbits that we could do that could prevent these oral diseases, such as brushing our teeth 2 times a day with proper toothpaste, flossing our teeth daily, snacking in moderation, and if there's morning sickness or frequent vomiting, instead of trying to brush our teeth away drinking acidic soda, we could try rinsing our mouth with a teaspoon of baking soda and water to kind of stop the stomach acid from attacking the teeth. And of course, visiting the dentist regularly. Preventing caries in children, there are a few simple tips we could give that could really prevent caries in our kids. Only having milk or water in their bottles, making sure that the kids finish their bottles prior to nap or bedtime. So basically, we want the kids to sleep with clean mouth, wiping their gums and teeth after each meal, and cleaning their teeth 2 times a day with a proper amount of fluoride as well. And we actually do recommend across the board to visit a dentist by the child's first birthday. At this time, they won't have that many teeth, but this is the perfect time to make sure that we can deliver all of the little tidbits of prevention to hopefully make the child healthy to never actually have to deal with caries at all. So I went through these slides pretty quickly, and I do think I see something about there was the sound going in and out, but We will have, again, time, so please feel free to ask your questions, and know that you will have access to our contact information and these presentation slides as well. So I want to thank you for your time, and I'm going to pass the torch to Kaitlyn Crowley to talk about how we can help families get access to oral health care.
Great, thanks so much, Lisa. So as I mentioned, as Michaela mentioned, I'm Kaitlyn Crowley. I'm a Senior Policy Associate with the Children's Partnership. We're a children's advocacy organization headquartered in downtown LA. And I'm going to talk briefly today about accessing dental care, including kind of addressing some of the common barriers we all know exist in getting dental care. And I'm going to do a quick overview of the different ways that children and pregnant women can get coverage for dental care through Medi-Cal. And obviously, this is a very detailed subject that would probably have enough information to have a whole webinar on its own. So please know, as has been mentioned already, that we're going to be sharing these slides as well as a bunch of follow-up resources afterwards. So that will certainly be helpful as you take a look back through all the information that we've shared with you. So with that, as you just heard from Lisa, regular dental care is incredibly important for pregnant women and children, and prevention can help avoid a lot of dental-related complications. But we all know that getting adequate access to dental care is not easy, and there are many barriers faced in trying to do that. So before I give you a little more information to that end, I just wanted to get a sense from all of you as people who work with home visitors. What are some of the most common barriers that you've experienced in your work? What are some of the most common barriers you've seen to getting dental care, whether it's for pregnant women or for children and their families? I would love if you have any thoughts to that. We'll go through some of the ones that we know to be true across the board, but if you could put it in the chat box, it'd be really interesting to see what you guys have come across in your work. It looks like we've already got some people sharing that cost is definitely a barrier. Also, not realizing that they were covered through Medi-Cal. Those are two very big ones that we definitely know to be true. Also, finding a dentist that takes Medi-Cal. Restricted medical coverage, I assume you mean. They don't know where to find a proper dentist. Let's see, thank you all. You're all putting a lot of helpful things in here. I'm going to go through them as well as I can. They don't know where to find a dentist. Fearful of dentists. Some women have been told it's dangerous to see a dentist during pregnancy. Fearful of procedures, including, having restless children and anesthesia. Again, not knowing that Medi-Cal covers. Cultural barriers, lack of transportation, lack of dental education. Most are scared to find it if they have issues. Many people receive dental care only through emergency services. Definitely seeing a lot about fear and about things associated with having young children who might not, have an easy time being in a dentist chair. So thank you all for sharing. Definitely feel free to keep chiming in, but in the interest of time, I'm going to move through here. But as you'll see, a lot of these barriers that we definitely know to be true are ones that you've mentioned. Sorry. So lack of insurance, lack of knowledge of dental care, perceived lack of need. And that includes pregnant women not realizing that it's safe or necessary, cost, fear, logistical barriers, etc. So you have all really hit a lot of these on the head. So given that, we know that a lot of these can be related to just sharing more information, but some of them really are things that are difficult that relate to, lack of providers in your area that receive Medi-Cal patients, things that we know kind of require some larger and longer term solutions, some of which are underway. But today we can definitely be talking about what is available in terms of dental coverage and what kind of resources are available in terms of finding out where you can receive dental care through Medi-Cal. So just a quick overview. As most of you probably know, Medi-Cal is available to all low-income children under 19 years of age, and that's regardless of immigration status. And if a child has coverage through Medi-Cal or Covered California, they also have dental coverage, meaning that's available to all of those children. And pregnant women and adults now enrolled in Medi-Cal also have full dental coverage. Adult dental coverage for Medi-Cal recipients was not around for a while, but that was just completely restored at the beginning of this year. So that's definitely something to keep in mind. And as you'll see here to the right, I've highlighted a fact sheet that TCP has actually put together. We have 3 versions of this fact sheet in a number of different languages, and we'll make sure to let you know where you can access those on our website. But this fact sheet shows you the one that we've put together specific to Los Angeles County. And you'll see that we go through the information that lets parents know that their children does have dental coverage through Medi-Cal or Covered California, goes through the services that are covered through that dental coverage, and also lets you know where you can access information about your dental care and providers. So in Los Angeles County, you can actually get dental coverage directly with your Medi-Cal card, which I'll go through in a little more detail later, but directly through your Medi-Cal benefits. You can also use one of the 3 Medi-Cal managed care plans that provide dental: Access, Health Net, and Liberty. We also have a fact sheet that looks just like this, but it's a little different because it's for Sacramento County, which has mandatory managed care for dental coverage. And then we have one that's just in general for California, and it just talks about getting coverage directly through Medi-Cal, since managed care is only an option in LA and is mandatory in Sacramento. So again, I'll give you more information in our follow-up resources about how you can find all of these fact sheets, but they do give a lot of helpful information for parents, and also some little facts and tidbits about when children should see a dentist, and information about parents, single adults, and pregnant women. So just moving on, when we talk about coverage for pregnant women, things do get a little more complicated in terms of the different options that are available through Medi-Cal, but there are definitely different avenues to ensure that pregnant women who are covered by Medi-Cal, low-income pregnant women, do receive dental coverage. So I won't go through this in too much detail in the interest of time, but again, this slide in particular has a lot of rich information that you should definitely go back and take a look at, including this link that gives you a list of eligible health providers for presumptive eligibility, which is the first category I'll talk about. This is immediate temporary coverage for low-income women who are pregnant and might be eligible for Medi-Cal, but who are not currently enrolled. It provides a quick opportunity for a provider to get a pregnant woman or a woman who believes she is pregnant that coverage. And they must get dental coverage through an eligible health provider, a list of which can be found at that link. Full scope Medi-Cal, you must be a U.S. citizen or have satisfactory immigration status, but full scope Medi-Cal gives you access to a number of different services, including dental, at no cost to eligible pregnant women. Then there's pregnancy-related Medi-Cal, which covers all medically necessary pregnancy-related services for any pregnant women that might not fall into that full scope Medi-Cal category. And then there's also the Medi-Cal Access Program, which is a low-cost comprehensive coverage, which includes dental for pregnant women, and that is regardless of citizenship or immigration status. It does require a fee of 1.5% of someone's yearly income, though. So again, take a closer look at this, and we can also try to answer some of your questions at the end about this. We also have some resources and people we can put you in touch with if you have pregnant women specific questions. So just a quick overview of what I kind of alluded to before. For LA County, you can get dental care through just using your Medi-Cal benefits card, so that's the fee-for-service option, or through a dental managed care plan, and the 3 that are available are Access, Health Net, and Liberty. And these are the numbers you can call, their website, and that's where you can get more information about eligible dental providers. And then for Denti-Cal, so the fee-for-service, Denti-Cal is obviously dental through Medi-Cal. This is the information through DHCS. You can find information about providers through that fee-for-service option. And then, as you all probably know, there's a lot of different actual places to get care, and we understand that one of the barriers you guys discussed before is that in certain places there's just a lack of available providers, geographically speaking, and we certainly realize that transportation is a barrier. So those are things that certainly are important to hear about, especially from people like you as home visitors who are out in communities working with people who might be dealing with those issues head on, so we can think through kind of how we can talk about addressing those. But there are a lot of resources to let people know where there might be care available. As many of you probably know, federally qualified health centers, more commonly known as community health centers, are available. They are nonprofit healthcare providers that provide primary care and oftentimes dental care. And they accept anyone regardless of insurance status or ability to pay, but of course are equipped to take on Medi-Cal patients. So this is a quick screenshot. The website is also available on the slide. It lets you enter your zip code, and you can put a mileage radius in to find out where there are federally qualified health centers available to you around your zip code. So I've just given the example of a Los Angeles zip code, and it gives you the different locations. If you click those plus signs to the left, to the right of the name, it'll give you the website, and all the websites let you know, if they provide dental and at what sites they provide dental. Many of these health centers have multiple sites throughout the areas that they serve. There are also clinics available at dental schools. We can try to provide you a little more information about specifics for that with the resources we share. And then there's also public health dental clinics, which is something that you can find information about through the public health department website. We've also listed that at the bottom. That's a dental clinic list specifically, so it addresses dental services specifically. And so with that, I know, again, as Lisa said, I ran through that pretty quickly. We'll certainly have time for questions at the end. And as I mentioned, we have a lot of resources to share to try to kind of help follow up with some of the things that I mentioned in more detail. But thank you very much, and over to Jenny.
Jenny, have you unmuted yourself? We can't hear you.
Oh, I apologize. Super. So you can see my screen. That's great. So
actually, sorry, we can't see it right now.
Oh, sorry.
There we go. Okay.
Okay. Super. We're all getting used to this technology. So my name is Jenny, and I have been in the nonprofit children's health field for quite a while. I'm currently consulting and working with UCLA to in their School of Dentistry program. So I'm going to talk a little bit about the role that you as home visitors and other service providers can play in improving the oral health of pregnant women, young children, and families. And one of the reasons why home visitors play a critical role in getting children off to a good start when it comes to oral health is because their goal, home visitors' goals, and the close and consistent contact home visitors have with families provide an ideal opportunity for providing early preventative oral health education and services, while also linking families to needed care. Sorry, I'm having a hard time advancing my slides. Oh, there we go. So, I'm going to talk a little bit more about this connection between home visiting and oral health care. Since early childhood home visiting programs are fundamentally concerned with the health and well-being of young children, when feasible, they are a logical place to increase a focus on oral health. In other words, achieving good oral health for pregnant women and children contribute to meeting the goals of early home visiting programs. In addition, there is a growing recognition that the dentist is not the only provider that can address children's oral health needs. A team approach is necessary to provide comprehensive oral health education, care management, and treatment that families need, and home visitors can and should be an integral member of that team. Further, because of the unique role that many home visiting models play in reaching newborns and their mothers at a very early point in the child's development, they can play a vital role, and sometimes are the only ones, to play this role in oral health disease prevention, helping to set young children on a positive trajectory for good oral health later in life, and also helping pregnant women. This is a key part of healthy birth outcomes. Finally, I want to point out that there are the strategies that are used to achieve results in home visiting programs, such as early intervention, anticipatory guidance, education, that you as visitors are experts at, can be very effective in improving children's oral health. And related, there's an increased attention to the fact that early tooth decay that Dr. Nguyen talked about is indeed a chronic disease and should be treated using disease management tools, including parent education, family engagement, adoption of beneficial behaviors, and community and system support. So it really makes a lot of sense. That said, before I go to the next slide, we also know that there's a lot going on in a home visit, and home visitors, depending on the model, also have a lot of responsibilities. So what we want to recognize that up front. We wanted to recognize that up front, so that that we may have to find different, we may have to find ways to tailor home visiting activities to your own program and your own day-to-day activities. Sounds like people aren't able to hear very well. I'll keep going, and hopefully the sound will improve. So there has been some studies on how home visiting programs are working to improve oral health.
Jenny, this is Michaela. I can't hear you all at this point.
Okay, and I'm there to hear you.
Okay. You're on your phone, correct?
Yes.
Okay. Maybe try muting and unmuting yourself.
Michaela? Is this better?
A little better to me. Although folks in the chat box are saying the audio is bad for both you and I.
Yes. We can continue. We can schedule. Is it if folks chime in, is it getting better at all? Nope. Much better? Okay. Well, I'm going to keep going. Okay, I'm going to keep going. And if we have to redo this, we will. So I'm going to talk a little bit about the evidence, and then I'm going to try to go a little more quickly through the slides, but I'll try to talk a little bit more slowly so folks can capture the words. There was a study in the United Kingdom that worked with a home visiting program that showed a reduced level of dental disease in participating children as a result of the oral health education provided to mothers by home visitors. Another study demonstrated that anticipatory guidance provided first-time mothers during pregnancy and after the child's birth showed lower incidence of dental caries. There was a recent study in Wisconsin that demonstrated that home visitors with education and with home visitors going into the home and talking to families about oral health, they were much more confident in how they could work with families in improving oral health. And the parents also reported that they felt better about taking care of their own and their children's oral health. So the point is that there has been some evidence of this. So what can home visitors do? So there's a range, and again, recognizing that families have, or that home visitors have a bunch of responsibilities, and they may have other priorities or urgent issues that they need to address. But I'm going to give you examples of different ways that you as home visitors and other service providers can incorporate oral health activities into your activities. So you can do a quick oral health assessment where you can talk to the family about if they have previous dental disease. If the parent actually has a lot of cavities, there is a likelihood that the children will also have high rates of dental disease. Families from low socioeconomic and education status tend to have higher rates of dental disease. Children with special health care needs often have also have oral health disease. If you're noticing that the family is not drinking fluoridated water, like not drinking tap water, which is okay if you're in an area where the water may not be safe, but if they're not getting adequate fluoride, that's another sign that you want to make sure that that child is getting proper, or the family is getting proper oral health care. The next step that you can take is talk to families about the role oral health plays in overall health. Talk to them about the fact that pregnant women should go to the dentist, and start to bring up simple facts. And again, we're going to provide some resources for how you can do this. But these are short conversations that you can have with families. Getting a little deeper, there are trainings that you can get and UCLA can provide that allow you to learn how to actually conduct a visual oral health screening. UCLA or others, you can provide you with training where you can work with the mom to look in the mouth of the child, and there are some visual signs of dental disease indicating risk. A way to really engage the family in talking about oral health and having families make sure that oral health starts to become a priority. And then next, providing oral health education and using the tools and the skills that you already use, motivational interviewing. Again, we're going to link you to some resources, but using flip charts, having conversations with families about good oral health, asking them if they brush the teeth, encouraging them to do it once a day, and then moving on to twice a day, making sure they have toothpicks in the house and that they're changing them every 3 months. And they can do with the other services you provide, keep it simple. If you can get them to do one change at a time, that is a really good step forward. Finally, with all the resources that Kaitlyn provided, connecting them to health services, and really taking that next step in helping to case manage and navigate through the oral health care system. Again, all of these take time, but as you learn, you can become more confident and start to integrate one activity, and then with some of the families, and then start to integrate more. Some oral health resources that are created for home visitors. And again, these are great links. There's a curriculum. There are curriculums here, curriculi. There are fact sheets and other resources for you. And they're created just for home visitors. I want to tell you about another resource that that's available to you, that is starting to become much more available to organizations in the Los Angeles County area. It's called Smile Connect. And if you go to the website that's at the bottom of the screen, you can actually punch in your information. Let's say you're a Head Start provider, or you can punch in the information and connect to resources such as educational materials and oral health take-home kits, such as toothbrushes and toothpastes. The service is meant to connect you to providers that can provide oral health education or help you with an oral health fair in your community. Again, we can provide more in-depth trainings on this resource, but it's here for you. So before I hand it back over to Michaela to moderate the question and answer period, I do want to repeat that this webinar was meant to be an overview of the types of trainings and resources that UCLA and the Children's Partnership together can provide for you. We are available to come out and talk to individual groups. We are also available to provide more intensive training. For example, we can spend much more time on oral health disease, talk with you about, and provide training and resources for talking to families about oral health behaviors and how to talk to families about oral health, as well as spending much time in navigating the oral health care system. We know that folks who are working directly with families struggle to find dentists that take Medi-Cal, to come back and have questions about what the dentist. So we are available to teach you the skills in a much more lengthy format. This webinar was to introduce you to us, the resources we have. But that said, I will hand it over to Michaela, and she'll moderate questions. And so sorry for the volume issues. And again, we are able to repeat some of this information if that is necessary.
Thank you, Jenny. I'm going to go ahead and ask folks to type any questions you have into the chat box. I will also unmute the presenters in the hopes that they will be able to answer the questions without too much feedback. If that becomes a problem, we may end up having to either mute selectively or include questions in our FAQ that we send out after this. So feel free to go ahead and type questions in.
We did see a question about, I'm trying to scroll up, about Medi-Cal being available to college students. Medi-Cal is available to children up to I'm thinking if this is a question for college students who may be living on their own, it's eligibility guidelines and they're still dependent of their parents, yes, they are eligible up to the age of 20, depending on certain circumstances. But it's sort of a detailed, nuanced eligibility issue. It depends on the situation.
So we have a question that says, are any of the resources available in Spanish?
Yes. So I'm not of the resource on the resource page that I provided. I'm not sure which ones of those are available in Spanish, but I suspect that many are, and you can follow up with us, and we will actually, as part of the follow-up, indicate which is available in Spanish. In addition, the fact sheets that the Children's Partnership offer about how and how to use it to get dental care are available in Spanish, as well as about 13 other languages, many of the Asian languages, Arabic, and some other languages. So you need to go to the Children's Partnership website. So they're available there. And then I want to make that children are eligible for Medi-Cal up through age 20. Thank you, Lynn. And there was, hopefully folks saw the clarification that Lynn made about pregnant women being eligible for Medi-Cal through their presumptive eligibility. The application is acted on. Thank you, Lynn.
Okay, so another question says, during the presentation, it stated that babies should not have the bottle while sleeping. Does that include the breast while breastfeeding?
Lisa?
Sorry, let me just, there we go. You're unmuted
Hi,
now.
everyone.
Sorry, Lisa.
That's okay. Children can, baby bottle and breastfeeding is also nutrition, but also soothing for the child. So we're not actually recommending that they don't drink milk like prior to bed, but the most important thing is that milk residue is removed from the mouth and the teeth before the child sleeps. So if the child is sleeping and no longer drinking from the bottle, it can simply just be removed, and the mother or the caretaker can gently clean the teeth while the child is sleeping. Usually it only takes a few seconds, and the child might stir a little bit, but they usually do go back to sleep.
Lisa, are you
okay? And then
next question?
So I'll read the question. The question is, I have a family with a 5-year-old. All of his teeth have cavities. I spoke to the parent about dental care. She mentioned that he does not like to brush his teeth. What other ways can I support this family?
So I can take this one. There actually are a lot of resources out there. So there's way too many for me to list even on a couple slides. There is a really cute one that Elmo does. You can YouTube it. Google it, how I get my child to brush. But kids don't like to do a lot of things. They don't like getting their nails clipped. They don't like getting their hair cut. They don't like taking a shower or a bath. And so we kind of, instead of always trying to force them, we usually recommend that you try to incorporate it into something more fun. There's read a book and brush your teeth, at nighttime, or it can be a reward system where you don't get to play your video games until you brush your teeth, or it's mommy and baby time. The 5-year-old can brush their teeth with their mom, or while they're maybe watching a show. There's a lot of different answers, and unfortunately there's not one correct one. So I think in order to support the families, you kind of just find out what their barriers are and then help them to find what solution works for them.
Okay, another question was, how do you clean a newborn's teeth? I know you mentioned that a little bit about doing it while they're asleep. Is there anything else you would add to that?
I'm so sorry, I couldn't hear the, could you repeat the question one more time?
Yes. Sorry. The question is, how do you clean a newborn's teeth and or gums?
Oh, okay. So, so a newborn generally won't have any teeth. They do, but after that very first tooth pops out of the gum, we do recommend to use a tiny little bit of fluoridated toothpaste. On the market, they still do sell non-fluoridated toothpaste, but we have studies to show that fluoride is really beneficial in the right dosage. So let's say a child is 6 months old. I think that I have seen works for my parents is you can just get a little damp cloth. You can put a little rice kernel amount of fluoridated toothpaste there. You can just wipe all sides of the teeth and even the gums, which I think babies actually really do like. And obviously they're not able to rinse and spit yet, and that's okay. That little tiny rice kernel amount of fluoridated toothpaste is not harmful to them.
Great. So another question is, what products would you recommend for in their infant's teething stage?
Do you mean products that help with the discomforts of teething, or as in to clean the teeth?
It doesn't specify. If the person could follow up to that question in the chat box, we can come back to that one. The next question is, one of my clients has a 5-month-old that she suspects teething and has given him Orajel despite no actual teeth showing. Is this safe?
So I generally don't recommend Orajel. So it only gives a little bit of I guess only helps for a little bit of time, and there's actually associated things with it, and it's really hard to give the proper amount, or maybe and at that age it's to tell whether the baby is in pain. And so I think that would be best seen by a dentist, just to make sure that there's no sores or anything else.
Okay, so following up on that question that we weren't sure what it was referring to, the question was related to products to help with soothing the child who's teething.
Okay, so usually, discomfort with teething is a part of growing pains, I think, which is why we probably do call it growing pains. So I haven't really, I don't like to suggest Orajel, and there are a lot of safe chewable toys out there that are safe to handle, and I guess easy to find. Regarding any types of medications, I wouldn't. Sorry, what I'm trying to say is, if there is any type of fever or dehydration or anything like that that you think might be associated with teething, we actually don't. That doesn't. That's not proven to happen. So teething doesn't cause like really high fevers or severe pain. So if there is any of those, then you definitely want to seek care, either by your dental provider or by a medical provider.
Okay, I believe one last question, and I think you may have touched on this, but just potentially repeat. At what age can parents use a rice-sized amount of toothpaste?
That's a wonderful question. Thank you for asking that again. Yes, so as soon as that first tooth comes out, that's when we recommend to use that rice kernel-sized amount of fluoridated toothpaste. And how you would know whether it's fluoridated toothpaste or not, it's easy. You could just flip to the box, and there will have a word on there that says fluoride or fluoride ion there. There are many different flavors and brands out there. So I usually recommend to try to find one that the child seems to like.
Okay, so I think all the other questions you have answered. An additional question was, before the teeth come out, excuse me, can the parent brush gums with a damp towel? And I think you mentioned that that is okay, correct?
Yep, we do encourage that. But of course, just like cleaning the rest of the baby, you know, when you're cleaning their head and their arms, you clean it, I guess, softly. You wouldn't really scrub it. I believe I saw a question where somebody asked if it was actually dangerous, or somebody told them not to clean the baby's gums. But yes, we actually do encourage cleaning the gums when there's no teeth, but just gently.
Great. And then one last question was, is there any documented information in Spanish for clients to know what procedures are eligible for Medi-Cal during pregnancy? And I already saw that Lynn answered, it's all medically necessary procedures, and MCH Access does have some resources. We can include those in our follow-up email about accessing Medi-Cal, particularly the Spanish-speaking resources. Okay, if there are no further questions, we will end there. Thank you all for your patience with the sound difficulties. As I mentioned, this has been recorded. We will also put together an FAQ with the questions that were answered during or asked during the webinar, as well as send out some additional resources for you. And also just a reminder that we are also going to be sending a post-training survey, and we really encourage you to complete that. It'll be really quick, but the point is to figure out what additional oral health related surveys you would like information about. So thank you very much for your time, and again, I appreciate all of your patience with all of the sound issues. Thank you.